Hello everyone, and welcome to another session of POWHER BOX. I'm Shayla the Artist, and today I want to address the maternal mortality among Black women. Yes, I said it. Maternal mortality among Black women. This affects families, it affects communities, it affects our society. And, oftentimes when something has not personally happened to us, or we don't know someone close to us that has personally experienced this, you just can't believe it. I know that's how I felt. I read about this even before my pregnancy journey, and I was just like, really? Wow. It's not that, I turn a blind eye to racism. Of course, yes, I know racism exists, but I had this and still have this faith in our healthcare providers and system, and I couldn't believe it, and that's the honest truth. But I have personally experienced implicit bias within healthcare that I will share with you in just a moment. First things first, let's get to the stats. According to the CDC, Black women are 3 times more likely to die from pregnancy-related causes than white women. Let me say that again. According to the CDC, Black women are 3 times more likely to die from pregnancy-related causes than white women. Staggering, right? Alarming, right? Take a look here. These rates are alarming, and these aren't just numbers. These aren't just rates. These are lives lost. These are dreams shattered. Dreams of being a mother. Dreams of being a parent. Dreams of being a father. Shattered. Shattered. And you may ask yourself, why? How can this be? How can this happen? Now, I've explored some of the factors that make up this statistic, and they're quite complex. But the ones that I want to bring notice to are 4. Number 1, access to care. Quality access to care. Something I've touched on before, and my opinion, every single person on this planet should have quality access to care, no matter race, no matter gender, no matter anything. Every single person on this planet should have quality access to care. And oftentimes with inadequate care, there's late diagnoses, and things like this occur. The second one, implicit bias. I read somewhere that healthcare professionals underestimate the pain of Black patients. Many healthcare professionals believe that Black patients can tolerate pain much better than non-Black patients. Now, when I really dig deep and think about this is what comes up. Black people, our culture, we are strong. We are resilient. We have gone through some horrible things. We have gone through so many challenges, and we rise above, and we will continue to rise above. However, pain is pain. Anyone walks into a hospital, the doctor's office, and needs care, it's because they need care. We should not be treating Black patients any different just because you think that we can handle pain better. And I will share my personal experience in just a moment. Third factor, chronic health conditions. There are certain health conditions that are prevalent within the Black community, and two of them that I'm most aware of are hypertension and diabetes. And those are two things that need to be looked into with pregnant women that come into the hospital. There is an increased risk, and I believe that gets overlooked, and that's a contributing factor to the mortality rate among Black women, pregnant Black women. Fourth factor, mental health. Mental health, it is a real thing. Black women experience stress differently than other races. Black patients experience stress due to racism and implicit bias. It can take a toll on your mind and your body. And I'm all about the integral health concept, whole body health. Now, I'm not saying other races don't experience stress. I am bringing awareness, specifically to the Black woman, because it's near and dear to my heart. It's who I am, and I'm sharing my experience that is often overlooked. Let me tell you a story. So, I've experienced 3 ectopic pregnancies. I don't have any children. And I'm on a pregnancy journey now. What is an ectopic pregnancy? Well, my ectopic pregnancy in particular was growing in my fallopian tubes. And the pregnancy is not viable in the tube. It must grow in the uterus for it to be viable. Anyway, fast forwarding. My first experience of an ectopic pregnancy, I went directly to my OBGYN. I went to the office, and I didn't even think to go to the emergency room at the time. I knew I was pregnant. I was about, I would say maybe 7 to 8 weeks. And I just called up the doctor's office and I said, hey, can I get an appointment today? They got me an appointment, and I went in there, and there were so many people in the waiting room, right? I just kind of, I sat down and I was like, okay, well, they'll get to me. I sat in the waiting room for 2.5 hours before I was able to see my OBGYN. Mind you, I'm sitting in the room, I'm bleeding out, I'm tired, I hadn't fully experienced any pain yet, but I'm bleeding out and I'm scared, I'm terrified. I don't know what to expect. I don't know what to do. I'm just sitting waiting for the doctor. I told the reception desk, I told the nurses that this is all happening to me. I'm pregnant and I'm bleeding. But they told me to sit there and wait. After 2.5 hours, I see my OBGYN. I guess she walked in from lunch, or maybe she was delivering a baby at the hospital. I don't know. She walked in from somewhere. She was chewing. She had food in her mouth or whatever. And she walked to the back, and then they called my name. I went to the back. She looked at me a little bit, went through my chart, did a pregnancy test to verify that I was pregnant. And then she just said, well, it's too soon, too early, too soon to know really what's going on. Sometimes pregnant women bleed a little bit, but if you're not in pain, I'm going to go ahead and send you home and just monitor it. And she said, if you experience any pain, go to the emergency room. Okay. I left. I went home. I give it about, the next morning, actually. The next morning, I started to experience some pain and more bleeding. So I went to the hospital. I went to the ER, and more waiting, of course. This is just part of this. And I remember the nurse in the ER, or the physician in the ER, rather, she asked me some questions about, my pain and what I was experiencing. And really, it was just bleeding. And my pain was like, from 1 to 10, it was maybe like a 4. But even then, maybe it was even higher. But I was kind of trying to act like I was okay. Maybe. Yeah. I don't even remember really what happened. It's all a blur, me being in there. I just remember just bleeding. And then she had said something to me like, I think you're experiencing a miscarriage and we're going to go ahead and send you home. So you can just, you may expel it on your own. And then follow up with my OBGYN like a week later. Yeah, that's all I was given. I'm crying. I went home. I'm telling my husband about all of this, and I didn't know what to do. I had no information. I really didn't know what to do at that point. That was my first experience. My second experience was this was either my second or third ectopic pregnancy. I'm not so sure which one it was, but I think it was the second one. I was experiencing even worse pain, knee buckling pain. And my husband and I he took me to the ER. They asked me what my pain was from 1 to 10. I told them a 6. So a little bit up from a 4, but I said a 6. In reality, the pain was like a 10. I was having these like contraction feelings, and I'm bleeding at the same time. And once again, I'm scared and I'm nervous and I don't really know what's going on. I knew that I had an ectopic pregnancy from before. I knew what that kind of felt like, but this was even more intense. And I didn't have anyone explaining to me maybe what this was supposed to feel like or what I was supposed to do. Thank God I changed doctors. I got a better OBGYN. But the way that insurance works, I was in network with my OBGYN, but the hospital that he was affiliated with did not take my insurance. Therefore, he could only talk on the phone to me when I went to the ER that was in network with my insurance, right? And to this day, I am so thankful. I am so grateful for this OBGYN because he is the only doctor that has fully explained an ectopic to me, what to expect, what not to expect, and to get myself to the ER, even if I'm feeling just a little bit of something because of how dangerous an ectopic is. See, I didn't even realize how dangerous an ectopic pregnancy was until this doctor explained it to me. And I was so sad because when I got to the ER and they told the physician that was in the ER, she told me, again, I think you're having a miscarriage and, they did blood work on me. Oh, your hormone levels are going down a little bit. So we're going to go ahead and send you home and you'll expel the pregnancy on your own. Like what? My OBGYN at the time was on the phone with me. He said, Shayla, do not let them send you home. You've had an ectopic pregnancy before. You could be having another one now. And I am so sorry that I'm not able to do your surgery if you need it. But you tell them to keep you there, give you an ultrasound, and get you into surgery if you indeed have an ectopic pregnancy. I handed the phone over to that ER doctor, and my doctor I could kind of hear him a little bit. He let into her. He said, "How dare you send her home? This is a serious matter, and she is my patient. She needs to be taken care of." For that, I am so grateful. I am so grateful for that, because anything could have happened. Anything could have happened to me. I ended up getting into surgery, and they said I was minutes from my tube rupturing. And when the tube ruptures, you have internal bleeding, and there's more risk and more chance of having to get blood infusions. I do my best to search far and wide for the best care that I can, with what I have, with the insurance that I have. And if something doesn't look right and doesn't feel right, I will change doctors. And I can't stress enough to advocate for your own care. If something doesn't seem right and doesn't feel right, it's okay to get someone else, or ask questions and get someone else. And I also realize that not everyone has the same privilege that I do with the access to care that I do have. But advocating for your own health is so important. Before I wrap this up, I want to share one more story. And I believe this was my third and final ectopic pregnancy. I found out I was pregnant again, like usual, and started feeling that pain and bled a little bit. And initially I was worried. And I kind of thought in my brain, up, this is another ectopic pregnancy. I called my doctor at the time, and he wrote up a ultrasound for me. And I immediately went over to the radiology clinic to get the ultrasound. When I got there, just like that waiting room that I was at before, there were so many people there. They told me at the front that it could be over in a couple hours wait, right? I sat and I waited. And I remember when the ultrasound tech came from the back, and she went over to the list to see who was there and who was next, right? I was way down that list. I don't know where I was, like number 60 or something like that. But she must have saw the reason I was there, and she took me right away. I think I sat in the waiting room for all of 10 minutes. She took me right away. It was a black ultrasound tech. She took me to the back and, got me all ready, did my ultrasound. And afterwards, she looked me in my eye and she said, "I'm going to get your results over to your doctor as soon as possible. Take care of yourself." And if you know anything about the ultrasound techs, they're not supposed to communicate results or anything directly to the patients. It must be delivered from the physician to the patient. But when she looked me in my eye and told me that, I knew it was an ectopic, but I also felt comforted, because I felt like she was giving me something that I had never had before, which was like this peace of mind that I was getting the quality care that I deserve as a human being. And she was a Black woman. It was Black woman to Black woman. However, I personally feel that she was a good healthcare professional, and she would have treated me and anyone else the same. But I'm so appreciative that she gave me the quality care that I deserved and gave me peace of mind that I was going to be okay, and that she was going to give the right information to the physician to be able to take care of me. I don't enjoy sharing things like this. I don't enjoy sharing stats like this. But the truth is, it exists, and it sucks that this has to be a conversation. And for those who just don't even believe something like this, do some more research, because it's a real thing. It is a real thing. And I praise God every single day that I'm here to speak about it, because things could always have been different for me if I hadn't had that healthcare professional, that OBGYN advocating for me and pushing for me. I had 1, 2, 3 more chances at life at that time. Thank you so much for joining me today. Don't forget to subscribe and share this with anyone who wants to learn more and share stories about reproductive health. Let me know your thoughts in the comments. Thank you so much, and have a good day.